Hello, this is Dr. Mercola, and if you've been following me for a while, you know that I'm absolutely passionate not only about my own health, but about teaching you and your family inexpensive choices that you can make so that you don't have to necessarily rely on expensive and potentially dangerous medications and surgical interventions to keep yourselves healthy. And in my journey over the last 3 decades, I've learned a number of incredible tools that you can use. And if you've been following my site for a while, you'll know these. Some of the primary ones are emotional freedom technique, which is a form of energy psychology acupressure that is just beyond profound. Nutritional typing, which is a system designed to select foods based on your specific unique biochemistry and metabolism. And then omega-3, the use of omega-3 fats, such as fish and krill oil, which are just enormously useful. Along the same time I learned about omega-3 fats, I learned about vitamin D, and my interest in this topic has just grown exponentially because there's just so much new evidence that's coming out in support of the value of vitamin D in the treatment of so many chronic degenerative diseases. And last month, actually in October, mid-October of 2008, I was invited to speak at ACAM, which is short for the American College for the Advancement of Medicine. And this event occurred in Las Vegas. And unfortunately, when I got there, I was told that they were not going to be video recording this lecture. So the information I presented at that event was so important that I decided to put together this video to give you the highlights and essentially even a better version of the presentation I gave in Las Vegas. Because this information is just vital for you and your family to understand and implement, because we are going through literally a public health crisis of epidemic proportions based on simple, pure ignorance and misinformation. And the purpose of this video is to enlighten you and help provide some of the details that you and your family need to know so that you can apply important research that has been uncovered within the last 5 or 10 years. Now, as many of you know, I am an avid reader and reviewer of the literature, the medical literature, and that's how much of the information gets transmitted to the site. But in addition to that, another important part of sharing research and information is to talking to some experts. And I'm very grateful to have had the opportunity to personally connect with some of the major experts in this area. Let me just mention some of them now. Dr. Bruce Hollis, who's been one of the premier researchers in vitamin D, testing a whole variety of other areas, is a PhD clinician for the researcher for the last 30 years. Dr. Reinhold Veith, another expert out of Canada, has done has been an enormous pioneer in vitamin D. Dr. William Grant, who's done profound research on epidemiology and the connections with vitamin D, and I'll be sharing some of his information shortly. And then Dr. John Cannell, who is just passionate like I am in putting this information together and has come up with some really interesting impressions. So I've spoken with all these individuals at length, and they've really helped me create a better understanding of what the potential is for vitamin D, and I want to share that with you in this presentation. And it's important to know that basically all truth, not only information about vitamin D, but almost all truth goes through 3 distinct stages. The first is that it is ridiculed. Secondly, it's violently opposed, and I believe with vitamin D we're somewhere in that range of ridicule and violent opposition. And then finally, it is accepted as self-evident truth. And we've got a ways to go to achieve that with vitamin D, but unfortunately, and I'm confident we will achieve it, but it's just a matter of time. So it's really important to have that grounding, that perspective to understand that this is not necessarily a cultural or social bias against any health truth. It's just the nature of truth adoption in our culture. Now, to help explain this as it relates to vitamin D, the reason why we're in a violent opposition to vitamin D, and they're certainly being ridiculed, is that some of the major medical organizations in the U.S. do not accept this truth about vitamin D. In fact, the American Cancer Society, the National Cancer Institute, both are opposed to the concept that vitamin D can be a useful adjunct in the treatment of cancer. And in fact, there's a whole variety of concerted interests that I'm beginning to appreciate and understand, primarily related to the pharmaceutical industry, that is really violently opposed to this, because when more people understand this information, they are going to make choices, implement strategies which will limit them from using their expensive solutions. So as a result of that, there's a trend towards suppressing the researchers who are providing this information. An example of that would be Dr. William Grant. He calls these the power of darkness, and he's experienced this directly, and they've actually orchestrated media campaigns to discredit him, and he has had many of his papers rejected. So fortunately and ultimately, the truth does come out. And if you're interested in more of the details that I'm going to be mentioning, you can certainly look on my site, but I've also written a book called Dark Deception, which was just published. It's taken me about 2 years to put together, but it goes over in a comprehensive way a lot of the material that I'm going to be mentioning in this presentation. Now, one of the major reasons why I like vitamin D so much is that it really gives you one of the biggest bangs for your healthcare dollar that you could possibly get. I mean, the benefits are beyond profound, and in many cases, of course, the simplest way that you're going to get vitamin D is by sun exposure. It doesn't cost you anything, and that's why I'm really on a massive campaign to help educate everyone so they can have a really thorough understanding, and once they have this understanding, then they will go out and implement and take actions to make sure they and their family are getting this important supplement. Now, John Cannell had mentioned to me, and I thought it was so appropriate, that he believed that Linus Pauling had it right, except he was off by one letter. So the contention is that vitamin D is so much more profound, so much more beneficial than vitamin C. Not that you have to have one or the other, of course, but if I had a choice, I would take vitamin D over vitamin C any day of the week. And vitamin D is actually not a vitamin. It's actually a pro-hormone. It's a neurosteroid. And this is the key to understand. Vitamin D is a powerful epigenetic influencer, and it's responsible for the regulation of over 2,000 genes. Now, many of you know that the Human Genome Project was completed a few years ago, and the big surprise of that project was that we thought there were hundreds of thousands of human genes that differentiated us from lower animals. But what we found, it was only 30,000 genes. And vitamin D influences 2,000 of these genes, and that's why you'll find that it's so crucial and so important for so many diseases, not just simple osteoporosis or rickets prevention, as it was believed to be so important for so many years. And I'd like to review some of the other uses of vitamin D so that you have a comprehensive understanding of the utility of vitamin D. Vitamin D is very useful in the control of your weight. So if you're obese or overweight, like 2/3 of the people watching this video most likely, then you're going to want to make certain that your vitamin D levels are appropriate, because it will help you optimize your weight. In addition to that, it's also used for hypertension or high blood pressure. So rather than taking expensive medications that could potentially be harmful, it's going to be useful to optimize your vitamin D. One of the most important uses that have recently been uncovered, and this is a hypothesis Dr. Cannell came up with, is that it may be one of the more significant influences in the development of autism. As you know, autism has become an epidemic, and the ranges of the incidence vary, but even the most conservative estimates are at least 1 in 150. And some other estimates in certain communities, the incidence may be as many as 1 in 50. And if you consider the autism a spectrum of illness, it may be as high as 1 in 10. So it's affecting massive amounts of our children. And Dr. Cannell's theory is that one of the major contributing factors to this is a vitamin D deficiency, certainly in the children, but more importantly in the women. So as they're bearing their child in gestation in utero, when the vitamin D levels fall below a certain threshold, that's going to cause a significant risk, especially if the child in utero is exposed to other triggering factors such as heavy metals and toxins and vaccines. So that can be a major, major reason why anyone who is pregnant, absolutely anyone, needs to make sure that they have optimized vitamin D levels. And I'll talk about what those levels are in a moment. There is no question that vitamin D plays a central role in every single autoimmune disease. What's an autoimmune disease? Well, the most common ones are diseases like multiple sclerosis, but also rheumatoid arthritis and inflammatory bowel disease like Crohn's disease. So if you have any of these, it is really important to optimize your vitamin D levels. And these are one of the conditions like cancer where I think it's criminally negligent malpractice if you have one of these serious diseases that if you aren't monitoring your vitamin D levels. So, and just to give you an idea of the strong correlation with multiple sclerosis, autoimmune diseases, I'm going to show a graph of multiple sclerosis where you can see on the bottom axis the latitude, which is the degrees away from the equator. So the closer you are to the equator, you can see the lower the incidence of multiple sclerosis, but the further you go away from the equator, the higher the incidence of multiple sclerosis. And this is true for the other diseases, the other autoimmune diseases also. Now, most people aren't aware that vitamin D is actually a potent antibiotic. It increases very specific antimicrobial peptides that can help prevent many infections. The specific protein is cathelicidin, or LL37. That is why vitamin D can be so helpful in the treatment of many acute infections that we see, such as upper respiratory infections like coughs, colds, the flu. And one of the ways that we learn this is by evaluating these flu epidemics that we've had in the past, but also in the treatment of tuberculosis. Many of you may not be aware that over a century ago, that long before we had effective antimicrobials to treat tuberculosis, that sunlight therapy or heliotherapy was one of the primary ways that people with tuberculosis were treated, and they had incredible resolutions. They went to these solariums, and people with tuberculosis got better. So you can actually use vitamin D acutely for infections, and I'm going to talk about that dose later in the video. But you can use it in a relatively large dose for a few days to actually upregulate your immune system to invoke these specific anti-infectious proteins to help your body rid the infection quickly, easily, and inexpensively. Now, interestingly, not many of us want to age, of course. So another important role of vitamin D is actually in limiting and slowing down the aging factor, like in conjunction with many of the other tools that we know work really well for that. Now, vitamin D is profoundly useful in many skin conditions, such as psoriasis and eczema. It's also helpful for insomnia, so you have trouble sleeping, as so many people do, that you're going to want to make sure that your vitamin D levels are normalized. Hearing loss, who would have known, but vitamin D seems to play a major role in hearing loss, as it does in muscle pains and periodontal diseases or cavities or gingival hypoplasia. Now, not a crucial one because it's not really affecting diseases, but it's also interesting that vitamin D is also enhancing athletic performance. But it's been shown to be a major factor in the most common cause of blindness in the developed world, which is age-related macular degeneration. And for those of you who require the use of reading glasses, then that's a problem called myopia, but vitamin D is shown to be very useful in that condition. So not only do we know that it's crucial for pregnant women to have optimized vitamin D levels to limit the risk of autism, but we also know it's helpful to prevent preeclampsia, which is an important complication of pregnancy. But it's crucial to have optimal vitamin D levels even before you're pregnant because it's one of the major factors that contributes to fertility. And vitamin D is also useful for many neurological and mental challenges, such as depression, Alzheimer's, schizophrenia. It's also been useful for migraines and asthma and cystic fibrosis. And one of the most novel approaches, and you've seen about it on my site, and I just wanted to go into some specific details here because it's such an important application, is vitamin D may be the single most important chemotherapy agent ever uncovered. So it's an enormously influential and important part of the treatment for cancer. And I'll go over the specific reasons why I believe that's so in a few minutes. But I believe, like many of these other diseases, any serious chronic degenerative disease, if you have not looked at and monitored and optimized your vitamin D levels, you are missing a major part of the successful resolution of your health challenge. So let's talk about vitamin D and cancer a bit now. But after I finish that, I'm going to go into the important ways that you can actually measure vitamin D and some of the concerns that you might have about getting vitamin D from the sun. So really important information, but I just did want to talk a little about cancer because it's so important. Now we know that vitamin D levels are crucially important in the management of almost every single major cancer category, and that would be breast cancer, prostate cancer in the men, lung cancer, colon cancer, and interestingly, it also reduces, does not increase the risk of melanoma. Now, just to illustrate some of the epidemiology and the correlation of sun exposure and cancer, you can look at this slide and you'll see the areas in the blue. This is the first slide shows the relationship between colon cancer and areas in the U.S. at least. And you'll see the blue areas are areas with higher colon cancer incidence, and the areas in the actually lower colon cancer incidence, and areas in the red are areas where higher. So you can see that the further north you go, typically, and the further away you get from the equator, the higher the incidence of colon cancer. And you can see, as we switch to the next slide, that correlation also appears to be present for the breast, prostate, stomach, and kidney cancer. Now you might be wondering, for those of you who have a scientific bent, how vitamin D works to inhibit cancer. Well, it does so for a number of very well-established, clear mechanisms. It does so by increasing cellular differentiation and a process called apoptosis, or cellular death. So it helps kill those cancer cells more quickly. And on the components where it inhibits things, it actually inhibits cancer cell proliferation. It decreases the ability of the cancer cells to become invasive and increase into a metastatic potential potential, so it limits their ability to spread to other tissues. It also decreases the angiogenesis, which is the ability of your body, of the cancer cells, to stimulate new blood cell growth to feed its growth. So it decreases that. And it also decreases inflammation generally, which of course is very useful to inhibit the growth of cancer. Now, I believe that we were all designed to optimize our vitamin D levels through exposure of our skin to appropriate amounts of sunshine. Now, I know that may seem like a controversial area to many, and I'm going to go into some of the objections to that philosophy in a moment, but I still want to finish up this information on vitamin D and cancer first. But I believe that's the way that we were designed to do it. I believe it's the optimal way. So I want to review some of the mechanics of how exposing your skin to sun actually results in increased vitamin D levels. So there are many wavelengths that are present in sunlight. For our purposes, the ones that's important to understand are ultraviolet radiation, and that breaks down to actually three forms of it, but there's the two primary ones we need to be concerned with are ultraviolet A and ultraviolet B, or UVA and UVB. Now, the UVB is actually what contributes to the formation of vitamin D in your body. The UVA actually increases the risk of cancer, and that's an important component that we'll come back to in a moment. But essentially, what happens is that you need 4 UVB photons to combine with one molecule of cholesterol, actually specifically 7-dehydroxycholesterol, in your skin. And that actually will form what's called vitamin D3, or human vitamin D3. So there is another type of vitamin that's used, and it's a synthetic form. It's vitamin D2, but your body makes vitamin D3. So interestingly, your body will tend to take this vitamin D3 because it doesn't use it by itself. It has to convert it into an activated form of vitamin D3. And these are actually available by prescription, but your body makes it by itself, and it does this in two different ways. The first way is that it will provide a hydroxyl group, or an OH, and it does this primarily in the liver. So it attaches a hydroxy group to this vitamin D3, and then what is formed is what's called 25-hydroxy vitamin D. And what happens from there, that's not the active form, but that is a real important form. We'll talk about that in a moment. That vitamin D, the 25-hydroxy vitamin D, then is further converted to the active form, which is 1,25-dihydroxy vitamin D, where your kidney or other peripheral tissues attaches another hydroxyl atom to that vitamin D. So it has two hydroxyl atoms, and that's the form of vitamin D that works in your tissues. But it's important to understand that it's virtually never necessary to ever take this form, because there are very few genetic metabolic defects that will, or clinical conditions that will limit your body to make that form of vitamin D. Essentially, if you get vitamin D into your body will take care of the rest. The metabolic machinery is there. The challenge with the vitamin D deficiency is getting vitamin D3 into your body. And the ideal way to do that is with UVB exposure. Secondarily, you can swallow it, but then you're going to run into some complications, as we'll talk about in a minute. Now, it's important, if you're going to apply the information in this video and all the knowledge that's known about vitamin D, I think it's in most every circumstance, it's going to be very difficult to achieve the maximum benefit without somehow, some way, testing regularly for vitamin D. And so it's important to have a good understanding of what vitamin D testing involves. And this slide is really crucial to develop that understanding. And if you look and carefully examine this, you'll see the levels of the different various forms of vitamin D in your body. In the first bar, we see the levels of vitamin D3, which you can see are very low. But then the next graph is actually the levels of the 25-hydroxy vitamin D3, which is the one that we test for. And the slide for that is the activated form with the two hydroxyls. There's 25-dihydroxy vitamin D. And you can see those are very small levels. So for the most part, you really can't measure vitamin D3. It's not a commercial lab. But what we can measure for the last two, and a common, let me repeat, a common mistake that is made because there's so much ignorance about this issue in the medical community, is that physicians will test for the 125-dihydroxy D, which is not necessary, and it's an expensive test, and in most every case, it's just unnecessary to do. So you can get the test, but what you really need to look at is the vitamin D3. Now, there are a number of different ways to test for 25-hydroxy vitamin D. And I'm going to simplify this a bit, but basically it breaks down to two different types of tests. One is called a mass spec test, and the other is called an RIA test. There is another way that you can do this, that you can actually do this at home, that you can actually, there's a home kit that you can do a blood spot test where you can basically prick your finger, put it on a piece of paper, mail it into a lab where they do actually a mass spec test, but this is a mass spec that has been calibrated to be virtually identical with the diasorin assay. So that test is also accurate. So you can either do a home test or a LabCorp blood test. The home test is a little more expensive because the mass spec is a little more expensive technology, but those are definitely the options that you have. So when you get those test results, what numbers are you looking for? Well, let's look at this graph, and it shows you what those levels ideally should be. And this is somewhat controversial because it's not really well defined at this point, but clearly the trend in the literature is to recognize that you are deficient if your levels are below 40 and as high as 50. In fact, Dr. Bruce Hollis found that there was no circulating vitamin D3 that could be found until the levels were over 40 to 50 nanograms per milliliter. Now, if you're watching this video overseas, you may be seeing different units used in your assay, and or internationally. In the U.S., we use nanograms per milliliter, but some of the other conventions would be nanomoles per liter. And to convert that, you just multiply the nanogram per milliliter times 2.5, and that will give you your other value. So continuing with these results, though, the optimal range that I now believe, and many others do, would be probably somewhere between 50 and 65 nanograms per milliliter. Again, if you have nanomoles per liter, you want to multiply with 2.5. So if there are some conditions, such as cancer and many of the autoimmune diseases that are present, such as multiple sclerosis or rheumatoid arthritis, that are really important issues that I think you really need to push those doses and really seek to get your levels up to 65 to 90 nanograms per milliliter. So I'd like to now look at some slides just to give you an idea of what the numbers are, what we see for preventing certain diseases. So you can see that once for rickets on this slide, that if you go up to 99%, up to about 20 nanograms per milliliter of vitamin D, 25-hydroxy D, you will prevent 99% of rickets. That's virtually almost all rickets, which is one of the most sensitive vitamin D levels is the rickets. This is why I believe that it was really only recognized for the longest time of being effective for this condition. But because very few people were getting to the higher, more therapeutic levels. On the next slide, we see a condition of diabetes. Diabetes is both an autoimmune disease and a chronic degenerative disease because there's two types primarily. One is type 1 diabetes, and the other is type 2. Type 1, we're finding, is very powerfully and closely related to vitamin D. So the further you live away from the equator, the more likely you are to have or type 1 diabetes. So that's another crucial reasons why pregnant women need to be optimized with vitamin D and their children once they're born, because insulin-dependent diabetes is definitely something you want to avoid. But it's also incredibly useful for the treatment and management of type 2 diabetes, the ones that's affecting nearly 1 in 3 people in this country, either with diabetes or prediabetes. So it's very, very useful. So you can see on this slide that if you get your level up to over 50, you have prevented nearly 80% of type 1 diabetes. With multiple sclerosis, a little bit about the same thing, you're up to 60%. And with falls and fractures, you can present half of them at very, very low levels. So the next slide, we can look at some of these cancers, and you're looking at up to 80% reduction rates of all cancers combined when your vitamin D levels are up to about 50, a little bit, somewhere between 50 and 55. So to me, I don't know of a more profound and more powerful argument to make sure that you and your family members have these optimized levels of vitamin D. Now, you can overdose on vitamin D, and this is the reasons why testing is so important. Not only do you want to make sure that you're getting enough vitamin D so that you're in the therapeutic ranges, but you want to make certain that you don't overdose, because there are problems with overdosing. And if you're really pushing these levels and you're a clinician or you have a close relationship with your physician, then you want to also ask them to check for your serum calcium level, because if your calcium level starts to rise, especially if it's normal, and your vitamin D level is high, or at least a 25-hydroxy D, then that's another sign that you might be getting vitamin D toxic, because one of the functions of vitamin D rather is to help you absorb calcium. So if you have too much vitamin D, your calcium levels will rise, and that is definitely a warning sign of vitamin D overdose. Now, as I mentioned earlier, one of my favorite ways to achieve optimal vitamin D levels is through UVB exposure. And when you're using UVB exposure, you're really not only almost eliminating your risk of overdose of vitamin D, but you're also achieving many other benefits other than simple vitamin D, because we know now just a simple issue of being in the sunlight will decrease your risk of depression or seasonally affective disorder. But there's a whole variety of other benefits that are associated. Most of them, my guess, is that we don't even know at this point, because the science is still too new. So if you achieve and optimize your vitamin D levels the way that nature designed you to do that, you're going to get all the benefits. If you shortcut it and try to optimize your vitamin D levels by swallowing the vitamin D, you'll get most of the benefit, but you run the risk. You run the risk of potentially overdosing, but also not getting the other benefit. So the practical challenge, of course, becomes if you're going to use UVB exposure or putting your skin in sunlight or tanning bed, then aren't you going to increase the risk of skin cancer? Well, that's what's commonly felt, it's commonly thought. That has been the reason why we have a literal epidemic of vitamin D deficiency, because one of the variables that I neglected to mention in Dr. Cannell's autism theory is that in the late 80s, this concept that the sun exposure is going to increase your risk of cancers was implemented aggressively by the medical profession in the U.S., and that's when strong recommendations were given to avoid the exposure of sunlight and to slap on and slather sunscreen all over your body. So about the late 80s is when this nonsense started to be implemented, and that's when we started noticing this gradual progressive increase of autism, and this fits in perfectly with his theory. So it also, we're starting to see many of these other epidemics occur. So this experiment in reducing our skin exposure to the sun has really been going on for the last 20 years. And it's interesting because in the last 100 years, our total exposure to the sun has actually significantly decreased, yet the increase in skin cancers has gone up significantly. So why is that? Why is that? Well, there are many reasons for that, but there's some important facts that you need to know. That there's a non-melanoma skin cancer. Now, melanoma is a dangerous form of skin cancer. That's a type that can develop into a very aggressive type of cancer that can be terminal. But the non-melanoma skin cancers are virtually never terminal. They're just more or less nuisances, and they're relatively easily treated. They're not dangerous cancers. So the recommendation to have for these aggressive avoidance of the sun is based on the danger and the risk of melanomas. And melanomas are, the death rate for melanoma skin cancer is only about 1,500 per year. 1,500 per year. Now, it's important to realize that some of the evidence suggests that, this is done by Dr. Grant, that in the U.S. alone, that somewhere between 200,000 and 300,000 people are dying every year from cancer alone because their vitamin D levels are too low. So we're seeking to limit the rate of death of melanoma skin cancers, which are 1,500 per year, at the rate of sacrificing regular cancers, the common ones such as breast, prostate, lung, and colon, which are 200,000 to 300,000 a year. And worldwide, the estimate is maybe 2 to 3 million people are dying every year from sun exposure, from cancers. So that may result from, for every death from melanoma, which doesn't even appear to be related to sun exposure, because I said earlier, it actually appears to decrease the risk of cancer. Yeah, and that to me doesn't seem to be a wise choice, and actually is the basis for the recommendation for this massive avoidance of sun and generating incredible amounts of fear into our culture that the sun is dangerous. So what are some of the other factors that can contribute to cancer and the sun? Well, we believe that one of the biggest is the content of the amount of omega-6 fats that you're actually ingesting. So omega-6 are common in plant oils and that are typically thought to be healthy, these polyunsaturated oils. But the problem is that if you have too many of them, and it's so common for us to do this, that you actually increase your risk of cancer. So almost all vegetable oils were really not designed to have that many of them. If you look back 100 years ago, the average intake of vegetable oils in our culture was probably about a pound a year, and now, a century later, most of us are consuming 60, 70, 80 pounds of these highly concentrated omega-6 vegetable oils per year. And what that does is it distorts this omega-6 to omega-3 ratios. Omega-3s are, of course, the very useful and powerful fish and krill oils that decrease all these different types of chronic degenerative diseases. So when you distort this ratio that we believe is one of the most significant influences that actually has contributed to this increase in cancers, especially some of these skin cancers. So, and there's of course been an enormous decrease in the amount of vegetables, especially high quality organic vegetables that their culture is taking. So when you decrease these nutritional inputs, you're going to decrease other antioxidant support that you can normally have for your body. So let me clarify that the comment and statement I made about sun exposure and melanoma risk, because there is an important distinction. Sun exposure, prudent sun exposure, has been shown to reduce melanoma risk by about 15%. But if you get sunburned, and I or know anyone who's prudent would ever recommend that anyone ever get sunburned. Of course, that's foolish. You never want to get sunburned. You always want to avoid that. So if you get sunburned, that can increase your risk for melanoma. But if you're prudently exposing your skin to the sun, that's not going to happen. Now, interestingly, what's been recommended, as I mentioned, since the late 80s is the strong endorsement of the use of sunscreens. And this is where it gets beyond wacky, because for essentially the last 20 years, the endorsement and the recommendation of the use of sunscreens has actually increased the risk of skin cancer. Now, how has that happened? Well, you may recall that I mentioned earlier there's two primary forms of ultraviolet radiation, UVA and UVB. And up until very recently, nearly all the sunscreens did not filter out UVA. And UVA is what causes skin cancer. But what they did do, they filtered out UVB. And guess what? UVB, as you know, is what makes vitamin D. So they're allowing the negative, the harmful UVs to come through. They're blocking the beneficial ones. So of course, you're going to increase the risk of skin cancer. And this is one of the reasons why we've had an increase in skin cancer for the last 20 years. Now, one of the other reasons, of course, would be that most of these sunscreens are toxic. What most people fail to appreciate is that nearly anything you apply to the surface of your skin will likely be absorbed and go into your bloodstream. So if you're applying something on your skin that you're not willing to eat, I'd be very cautious. And clearly that's the case for many of these sunscreens, that they have toxic chemicals in there that will increase cancer generally. So, but the primary one more than likely was related to the fact that they were blocking UVB but weren't blocking UVA. Now, if you're going to use sunlight exposure as the primary way that you're going to optimize your vitamin D levels, there's some important details you need to be aware of to do this, because it's not as simple as just going out and exposing your skin to sun. There's a lot of variables that need to be addressed. One of them is simply your age. The older you get and the less healthy you get, the harder it is for your body to actually synthesize and make vitamin D. And so people over 60 tend to have much lower levels of vitamin D. They just can't manufacture it. Now, there's, of course, some unhealthy 60-year-olds and some healthy 60-year-olds. So there's a wide range, even in age. But generally, the older you are, the more challenging it's going to be. And the higher your exposure requirements are, or oral vitamin D doses will be. Now, it's also important to realize that anything that decreases the amount of ultraviolet B radiation that penetrates into your skin will decrease the rate that your body forms vitamin D. Because remember, you need 4 photons of UVB radiation on your skin interacting with that cholesterol to turn it into vitamin D3. So what are those? Well, the obvious ones are the time of day. If you're going out at midnight, you're not going to get much vitamin D. Of course, but what most people don't understand, that if you go out at noon, and in most non-subtropical environments in the winter, if you're going out at noon, you are not going to make virtually any vitamin D. You need a critical threshold of UVB exposure to precipitate or to cause your body to make that. So there is a vitamin D winter, and unless you're in the subtropics or tropics, you're going to go through it. So sun exposure during those times will not work, and you need another option. But that's a tangent. We'll address that area in another issue. Let's assume you're not in vitamin D winter. The other variables are your skin pigmentation. So if you're a deeply pigmented individual, say your ancestors were from Africa or from India, where the people have really deeply pigmented skin, then you're going to need a lot more exposure to the sun for that UV radiation to penetrate so that it can actually manufacture that vitamin D3. Now, the other issue is that you have to have your skin exposed. Now, there in Saudi Arabia, which is clearly going to have more than enough sun exposure the entire year, the women there practice Purdue, and that's a form where you've seen where the Muslims, and they wear basically they wear clothing that blocks almost their entire skin. So even in the middle of summer, when they're going outside, they are not getting vitamin D because the clothing is essentially blocking almost all the beneficial UVB. So you've got to expose your skin. The more skin you expose, the more vitamin D you're going to make. Also, it's important to know that exercising is really helpful because ideally with lots of skin exposed in the sun. But when you come in from the exercise and you go and shower up, you need to know that you cannot use soap on your skin for like 30 to 60 minutes because that vitamin D3 needs to be absorbed into your bloodstream because it's formed in your skin. And if you're using soap, you're going to wash it off. So all the great vitamin D3 you made while you were outside is not going to penetrate into your bloodstream until you let it sit on your skin for a length of time. And we think at least 30 minutes, maybe an hour would be more optimal. So in this slide we can see that modern humans are true cavemen. That even in the summer, and this is true for just about most of us, of course, unless we're retired, we are working 40 hours a week inside. We're inside. So we are not having the ability to have vitamin D exposure on our skin. So those 2 days a week that we have on the weekend, if it's cloudy or raining, we're not getting it then too. So we may go for weeks without getting the ability to have vitamin D on our skin. And what most people fail to realize is that, well, in my home or my office and I'm getting the sun on my skin through the windows. Well, nice try. Most glass blocks out UVB so by large amounts. So you're not getting a significant amount of UVB on your skin when you get it through either your home window, your office window, or through your car window. It just doesn't work. So a simple tip that Dr. Cannell gave me to get an idea if you are actually making vitamin D on your skin when you're exposed to the sun or not is to simply look at your shadow. If you are shorter than your shadow, then your skin can make vitamin D. If your shadow is longer than you are, then you are not making vitamin D. Simple little tip. Now, as I mentioned, there is a vitamin D winter, so there's a seasonal aspect to the sun exposure. And there's, of course, a latitude aspect. So the further north you go, the closer you go to either of the poles, the less intense the sunlight is going to be, the less UVB photons there are to cause your skin to make vitamin D3. Now, if you're heavy, as 2/3 of our population are, obesity will be an impairment to your body forming vitamin D3. It also, because vitamin D3 is a fat-soluble vitamin, will also increase your requirements. So the heavier you are, typically, the more vitamin D you're going to require. Obviously, if you're applying sunscreen, well, maybe not so obviously for some people, but you are going to essentially eliminate your skin's ability to produce vitamin D3 when the sunscreen is applied. You're just not going to make it. The higher the SPF factor, sun protection factor, the less vitamin D you're going to make. So if you have a sunscreen with an SPF of 8, you are cutting down your vitamin D production by 97.5%. And if that sun SPF factor goes up to 15, and many, of course, are much higher than that, you're going to essentially eliminate. You cut out 99.9% of the vitamin D3 production. So these are the variables, the factors that you need to consider when you're exposing your skin to the sun when there's appropriate amounts of sun. So in other words, you're not in a vitamin D3 or vitamin D winter. So what do you do when you're in vitamin D winter and it's cold outside and you cannot expose your skin, or there's just not enough photons in the air to cause your body to make vitamin D3? Well, you don't have a lot of options. There's three primary ones. One is that you can snowboard and you can leave the current environment and to go to a subtropical or tropical environment or go to the other hemisphere and get your vitamin D3 that way. It's, of course, not convenient for nearly everyone watching this. I think it's ideal, but it's certainly not convenient. It's something you can move towards, and when I first understood this concept 6-7 years ago, I structured my life so that I can actually do that. I work from a warm environment in the winter now. But the other option is to actually go to a safe tanning bed. Now, it's really crucial that you go to a safe tanning bed. That is very important because there are unsafe ones. And how do you know if you are using a safe tanning bed? Well, there's two primary ways. One is that they use the type of ballast that they use. An unsafe tanning bed will use a magnetic ballast, and typically you can know that a tanning bed is a magnetic ballast by the sound that it's producing. It's a very high-pitched sound. If you've ever been to a tanning bed where it's very loud, you know that's a magnetic ballast. The other option that you can use is an electronic ballast, and these are virtually silent, but in addition to that, they produce virtually none of the harmful and dangerous magnetic radiation that the magnetic ballasts do. Additionally, especially if you are using a safe tanning bed at home, it's important to know that they're far more cost-effective and they're far less costly to run than the magnetic ballast ones. So they're far more electrically cost-effective. Now, the other way that you'll know, so that's from the safety of the tanning bed. The other component, though, is the actual bulbs that they're using, the design of the tanning bed, because normally most commercial tanning beds are using bulbs that are based on sunlight. And sunlight, as I said, has the UVA and UVB. What I didn't tell you, though, is that the ratio of the UVA to UVB is about 20 to 1. So in normal sunlight, about 5% of the ultraviolet radiation is UVB and 95% is UVA. Well, that's what most commercial beds are based on. But wouldn't it be nice to use a bed where you don't need as long an exposure because they can double it? So instead of double the amount of UVB. So instead of having a 20 to 1 ratio of UVA to UVB, there are beds that have a 10 to 1 ratio. So they have 10% UVB and 90% UVA. So that decreases the form of UV radiation that can cause the cancer, but it also increases the UVB radiation that makes vitamin D, so you need less exposure and you get more beneficial vitamin D in a shorter amount of time. So you can go to a commercial tanning bed, and if you're going to go to one, you want to make sure it's a safe tanning bed, or you can get ones that you can purchase at home. There are available commercially that you can use, and they're typically about $1,000 or so. And the convenience, the advantages of using the home ones is that they're more convenient, of course, because you don't have to waste time traveling. But also, what most people find is that the hygiene is a big issue, because that is a concern for many of these commercial tanning beds. You just don't know who used the bed before you, or what was used to sanitize the bed in between uses. So most people are concerned about this, and that's a concern that you can virtually eliminate if you have a commercial tanning bed at home. So what if you're not going to basically move away into an environment that can give you vitamin D, or not going to access a tanning bed? Then you really have only one option, and that is a vitamin D3 supplement. Actually, vitamin D supplement, because many people take vitamin D2, and as I mentioned earlier, that is not human vitamin D at all. If you're taking vitamin D2, you want to avoid it because it will interfere with vitamin D3. Now, in this slide, you can see the chemical structure of the differences between vitamin D2 and vitamin D3. Actually, they're both formed by irradiation of a substance. In the vitamin D2 cases, they're irradiating the ergocalciferol, which is found in plants. But typically, the way that vitamin D3 is formed is well, in humans, it's of course formed by UVB in our skin, but if you're going to get a vitamin D3 supplement, it's usually done by irradiation, UVB radiation of lanolin, sheep lanolin, and that's the way the most supplements are made. So what you want to avoid with the vitamin D2 is typically they're used in rice milks, yogurts, almond milks, and some soy milks and yogurts. As I mentioned, they shut down your vitamin D3 conversion to critical hormones, so that's clearly something you want to avoid. It's going to be really important for you to do that. If you're not going to get the vitamin D from D3 from the sun. It means you have to swallow it. Then how are you going to do that? Well, it's important to realize that vitamin D3 is pretty rare in foods. It is not in your diet typically. It's not designed to be in your diet. I mean, you can get it from some fatty fish, but typically it's not there. And interestingly, I used to believe for a long time we weren't designed to get it through breast milk because the evidence in the study suggested that it was essentially absent from breast milk. But that was because these studies were done on typical women, and most women are seriously deficient in vitamin D3. So if you are deficient in vitamin D, you are not and you're breastfeeding, you're not going to be able to give it to your child. But if you have a level that's closer to 60, 70, or 80, you will supply your child with vitamin D in the breast milk. Now, for those of you who've been following me for a while know that I've really strongly discouraged the use of vitamin D oral supplementation in the past without testing. I still strongly recommend it. Remember, there are simple tests that you can get through the blood test through LabCorp, and that's measuring the 25-hydroxy-D, or you can do the home test where you measure the same one. It's a little more convenient but a bit more expensive. So if you're going to do oral D, I strongly recommend the use of vitamin D testing because that will optimize it. It will do two things. It will prevent you from overdosing, but more importantly, it will get you into the therapeutic range because you just don't know how much you're going to need. And I'll tell you, the science on vitamin D dosing is too new. I've talked to some of the top researchers and scientists in the world on vitamin D nutrition, and the variables are just unknown because some people may need levels that are 2, 3, 4 times as high, and we just don't know why they need them. We just don't. All the subtle details have not been worked out yet. So you're really, to get to those optimal ranges, the really almost practical way to do it is to optimize it with the vitamin D testing. So I've become a pragmatist over the last few years because I've recognized the amazing importance of vitamin D, the fact that it influences over 2,000 genes, that's so important for almost every single chronic degenerative disease that I've realized that if you are not going to use or are unable to, for whatever reason, expose your skin to ultraviolet B radiation, then I've capitulated and surrendered to realize that some people are going to absolutely require the use of vitamin D supplementation orally. So I'm going to give you some recommendations on how to do that safely. Of course, the most important one is to measure your level. Now, if you haven't taken vitamin D before, more than likely, and you have not, especially have not been exposed to large amounts of ultraviolet B, sun exposure, or through a safe tanning bed, then you probably are safe to just start vitamin D3 supplementation because more than likely you're deficient. So I would just take the oral supplement oral dose that we're going to discuss in a moment, and have your test done in about 4 to 6 weeks after you start. Now, if you have no serious illnesses, such as the cancer or the autoimmune diseases, you can use about, in other words, you're healthy, you can use about 3,000 units for every 100 pounds of body weight. So for a typical adult, 150 pounds is going to be about 4,000 units a day. If you're a child and you're about 30 pounds, it would be about 1,000 units a day. If you have cancer or a serious autoimmune disease, then you want to increase that dose up to about 5,000 units for every 100 pounds. And especially for levels that are low, and you want to use that dose, but again, it's going to be really important that you monitor your blood test. I think there's very limited risk for a number of months of being on vitamin D levels as high as 10,000 units a day, and overdosing, but clearly if you're going to be on it for longer, you will run into a risk, and ideally you just don't know. So again, 10,000 units in some people may not even get you halfway to therapeutic range because of some of these variables that just have not yet been identified. Now, just to give you an idea on the safety, because some people may not realize how much vitamin D3 your skin makes if you've been exposed to appropriate amounts of ultraviolet B radiation, because these doses that I'm describing seem pretty high. Well, your skin, if you're exposed to optimal amounts of of UVB radiation, can make up to 20,000 units of vitamin D3 in one day. 20,000 units. So your body has the capacity to generate these types of ranges. Now, I mentioned earlier that you could actually use vitamin D3 orally to treat acute upper respiratory infections like the coughs, colds, and especially the flus. The doses on this would be 2,000 units per kilogram per day as a one-time dose. So you would take that every day for 3 days and then don't take it anymore, at least that high a dose. You want to take your normal dose about that. Now, it's really important to know that if you are taking these other doses I described earlier, the typically 4,000 units a day for most adults, then, and you've been doing that for a while, the likelihood of you acquiring an upper respiratory infection or the flu is very, very low. So you won't need this high dose at all. So, but if you haven't done that, or a friend or family member has not done that, and they have this, you may try this dose for them. So for many adults, it would be about 100,000 to 200,000 units a day for 3 days. Now, as you're considering dosing yourself or your children, it's important to realize that vitamin D3 has a very long half-life. So you could take your dose once a week or even once a month. I think it's a little more dangerous once a month, but once a week certainly. And so that if you determine that you needed 30,000 units of vitamin D a week, you could take that all at one day, once a week. So the absorption is pretty good. There's no risk of causing it to be excreted because your body will store it in your fat tissues and it stores it very nicely. And the half-life of vitamin D is probably on the order of 2 months or so. So it stays in your system very nicely. So hopefully this information was helpful and you'll be able to use it to incorporate all the wonderful new information that we're learning about vitamin D. As I mentioned earlier, I really believe this is one of the biggest public health epidemics and crises that we have, because something so simple as optimizing your vitamin D levels can have such a profound influence on your health by affecting, as I said earlier, over 2,000 of your genes that are important and responsible for developing nearly almost every one of the chronic degenerative diseases that we know. So it is crucial, especially for cancer and heart disease, which are really the biggest killers that we know of in modern day. So the message is to make sure you and your family members are optimizing your vitamin D3 levels. If you're watching this in the summer, then get outside. Make sure you have safe sun exposure. Never get sunburned. And have a good, healthy tan. This was sort of an indirect reflection of the fact that you're getting enough vitamin D. If you aren't, and if that is not possible for whatever reason, you're in a vitamin D winter, or it's just not possible for you to do that because of your job or work environment, then you can seek a commercial vitamin D UVB exposure, such as a safe tanning bed, with either a commercial one or one that you purchase for your home. If that's not possible, you can take the route of taking oral vitamin D for the dosing and the recommendations and the cautions that I gave. But if you're going to take the vitamin D3 orally, remember, you simply were never designed to take vitamin D3 orally, because you're not going to get all the benefits that you do from getting exposure to UVB. So if you're going to use that route, it's really important that you monitor your blood levels regularly for two primary reasons. One is to make sure that you get into therapeutic range, which is somewhere between 50 and 65, and higher, up to 80, 85 or so if you have cancer and autoimmune disease. But also important to make sure that you don't overdose. And if you're going to push the levels to higher levels, then you also are going to want to measure your calcium levels, because if your vitamin D level is too high, then your calcium level will also tend to rise. And that's a sign to you and your clinician that you're going to want to back off on your dose. So I strongly encourage you to take this information, to be an evangelist, to be an advocate, to spread this message, share this video with others, to let them know of all the benefits that they are going to receive by something as simple as optimizing their vitamin D levels.